All right, here's the post that I wanted to show you. So it's by Dr. Ilya Lipkin, and it's documenting a face mask being used in an adult male to treat a
Mm.
class 3. I'll read it to you, and then we'll go through the pictures, and I'll just, comment on how remarkable of a case this actually is. So it says right here, Dr. Ilya Lipkin, my post from a year ago just resurfaced, so I wanted to post an update to this non-surgical class 3 treatment. It's remarkable that I've started many since then on various ages, and will do some posts when I have a bit more time, but here's an update. So
Mm.
here's some pictures. We'll
Wow.
go through them. Okay, so here's
Yeah.
before and after. 18 months. This is 18 months of face mask. You can see this is where the guy started in a class 3. It's not a horrible class 3. I've seen much worse. I've seen class 3s that I've chatted with that are like a centimeter. I interviewed one not long ago, and here's what it looked like after the fact. That is ridiculous. I mean, look, it's completely
Mm.
cured. No surgery. Here's what he looks like head on, and yeah, just remarkable. What else we got here? Some scans showing
Yeah.
an actual change in the bone and what perhaps what they call the A point, the actual front of the maxillary bone, not just the maxillary teeth. Okay, very impressive.
Mm.
And here's 6 months progress. This is 6 months progress. So this is what it looked like after just 6 months. Class 3, and then some improvement. And you can see a distinct change in the nasolabial angle even after just 6 months. That's the angle between the upper lip and the nose has changed significantly in only 6 months. And then the patient ended up tripling that in terms of treatment. Initial
Mm-hmm.
records, that's not too important. Da 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 da. So yeah, 18 months, class 3 in this adult male cured with face mask.
Mm. Wow. I remember you talking
Yeah.
with Dr. Ting in that podcast, and he said you're very lucky to get like 1 or 2 millimeters, right? So does this kind of change that narrative?
I think so.
Okay,
I
crazy.
think so. And I think that, Dr. Ting said that years ago, and um, a lot has happened in the MSE world since then.
Mm.
There's been many, many, many cases done since then, and many experiments done, and innovations. And so I think what he said, I think he would be the first one to be willing to update that statement now,
Mm.
especially considering Dr. Ting is like, one of his good friends. Dr. Lipkin is one of Dr. Ting's good friends.
Mm.
Dr. Lipkin just placed Dr. Ting's MSE.
Mm. Oh, you
So
mean okay.
I could probably show you
Dr.
that.
Lipton plays Dr. Ting's like personal MSE. Oh
Yeah, look at
wow,
this.
okay.
Look at
I thought
this.
you
Can
just
you
meant
see
like
this?
he just helping out. Okay, well, that's yeah, wow.
No, look. Can you see this? Am I still
Could you
sharing?
read it? I can
Yeah.
see it.
So here's a picture of Dr. Lipkin on the left, and then there's Dr. Ting on the right. And it says, uh, when Doctor, this is Dr. Ting speaking here on Facebook. When he speaks of himself in the third person, which is funny. When Dr. Richard Ting is getting his skeletal expander, who does he go to? He travels 2,500 miles and goes to the best orthodontist, Dr. Ilya Lipkin. Thank you for taking great care of me. You are always a better orthodontist than me, back then in school and now. Also, thanks, Partners Dental Studio. DJ Emil's design was stunning. So, again, don't think of Dr. Ting and Dr. Lipkin as ever really contradicting each other. They are very much
Mm,
um, partners in crime, so
yeah.
to speak.
Is Dr. Lipkin gonna get one from Dr. Ting?
It's so funny you say that. Check this out. Check this out. Mariana Evans, who's also like one of the heavy hitters in this space, she said, "Doesn't Ilya need it more than Richard?"
Yeah, that was my first impression. Seems like Richard already has like a pretty wide smile.
Yeah. And then that, I've never seen a comment in this group get this much love, like 12 reactions. Um, Ilya Lipkin himself said, "You are so correct. I'm next in line." So maybe,
That's
maybe
so funny.
Courtney Donko chiming in, and Courtney Donko I'm having on soon. She's great. Um, and then Mike Mew even chimed in. What's Mike have to say? Mike said, Mariana Evans, now many people don't need, I think he meant to say, not many people don't need some type of expansion. And what does that say about where Homo sapiens currently are?
Mm,
In
so
other
true.
words, we all need an MSE, don't we?
Hmm.
And the answer to that question is we really fucking do.
So does Mike
We really
Mew
do.
change his
So
position on
then,
MSE, or I think he once said that like it was way too invasive or something, and he doesn't endorse it.
well, I mean, Mike is in this Facebook group. This is the MSE user group. So I heard that he was using. So I'm going to stop this share now.
Hmm.
Um, I heard that he was using MSE now. Yeah.
Mm,
I don't know for
interesting.
sure. I haven't talked to him about it personally. I did reach out to him, and he did say he was going to come on JawHacks for an interview
Oh,
sometime
great.
soon. Um, so I'll definitely be asking him all about that. But yeah, pretty much everyone at this point is on board with skeletal expansion being superior to tooth-borne
Yeah.
expansion.
And going back to the
Except for
face mask,
the
continue.
yeah, I was just gonna say, except for like the DNA providers and the
Oh
ACA
yeah,
providers,
yeah.
they're still in the cloud of delusion.
I want to get into that right after, but I was gonna ask like what made the face mask more effective now than before? Do you know?
I don't know. Maybe just like a faith and a willingness to actually try it,
Mm,
and maybe it only works on patients who have super compliance.
yeah.
Maybe there's some threshold, right? Like if you don't wear it at least 18 hours a day, you get more relapse than you get advancement. And so no one had really had patients willing to push it
Mm,
until Dr. Lipkin, for whatever reason, was able to get subjects to take the leap of faith with
hmm.
him and prove that it's possible. I don't know. Maybe it has to do with the surgical assists that Dr. Lipkin uses because he's using the piezo bone saw. Maybe it has to do with the angle that he's pulling.
Hmm.
Your guess is as good as mine.
Mm.